with Dr. Bullen, and this week we are going to talk about endotracheal intubation. What I had my nurse do was put an endotracheal tube in a dog for me, and I went ahead and videotaped that procedure. I know a lot of people get fearful and it's frustrating because one of the induction agents we do use, called propofol, tends to be very short acting, and so you feel like you're under the gun, and the biggest piece of advice I can give you is don't panic. So we'll look at some anatomy, we'll go through, put that tube in, and I'll walk you through the whole thing. So what you are going to see is the assistant picking up the jowls, so the top jaw, and leaving the lower jaw loose. Then you're going to see the tube come into the picture. You're going to see her struggle a little bit to get that in place, but you see the epiglottis fall down. And that epiglottis being placed down allows you to see your target. So I've got an anatomical.
So biggest information here that I can give you is you need to pick the right tube. The tube needs big enough to fill the entire area of the trachea, and that allows for good airway. You have more air being able to move inside and out. You need to lube the tube because it is a big tube, and then you're going to tie the tube in place so it doesn't move after we've gotten it in place. And then the final most important thing that we can do is inflate the tube. That protects us from things going around the tube and into the lungs. And so from a client standpoint, you need to understand that we are really protecting the lungs of your patient anytime they go under anesthesia by having this tube in place. The next thing from a technician standpoint is don't panic. You can see in this video how it wasn't going into place very well. She didn't panic. She just rearranged her tube, turned it a little bit, and it finally goes into place. See her tying it in so that that tube isn't going to move out of the trachea once it's in place. She'll then go ahead and turn the patient. You want to make sure they're not connected to the machine at this point because the machine tubing will pull on that trachea. So you want to disconnect. Then we'll go ahead and hook them up once we have them in the proper positioning for whatever surgery we're going to do. Then you see her inflating the cuff. So what we're doing is using a cuffed endotracheal tube, adding air to the cuff to fully seal off the entire trachea so things can't move around the trachea and down into the lung field. So this is how we protect your pet. This is how you would do an endotracheal intubation. You'll notice there she adds lube to the eyes in that final moment because these animals don't produce tears under anesthesia, and we want to protect the eyes as well. Thank you for watching another Vet Med Ed with Dr. Bullen. Make sure you like and subscribe.